Hello, everyone. Before I even get into literally any of this, I'm just gonna say that when I was in some of the most depressed periods in my life, some of the advice or stories that you're gonna hear today are things that would make me really mad. So if you click away, I harbor absolutely no resentment towards you. Trust me, I firmly believe that until you're ready to experience change, the things that I'm talking about in this episode might not be something that you're ready to hear. I still highly recommend that you try to give what I have to say a listen. Like, I'm not coming from a place of false reassurance, false positivity, or toxicity. I'm just trying to be straight with whoever is listening right now, and really, all I can do is give you my perspective. I can't tell you what to do. I'm not going to tell you what you want to hear. And I'm not going to give you advice, contrary to what I said. Just bear with me. I'm just talking about how I feel and how life has been going for me. Life is hard for most of us. Like, that's just the reality of it. And hard things happen. Even if you're more financially privileged than most, hard things are still going to happen in your life. Hard things happen to us all. We're all going to experience grief and mourning and sadness at some point in our life. Like, it's going to happen, but there will be upsides. Some things will make you happy, some things will make you fulfilled, and this will vary from person to person, but eventually there will be something out there for you. And my education and career is going to come up in this episode, so I just want to preface this by saying that just because I work in healthcare does not mean that I am your healthcare provider. I have no authority, am not a mental health professional, and I cannot diagnose you or tell you what's going on with you. I just want to have an emotional and maybe slightly intellectual, maybe not so much, conversation. But if you have any medical questions or concerns, please consult with your own provider or emergency health services. Without oh, with that out of the way, I just wanted to say hello. This is your friendly little alien in your phone here, or computer, or TV, or whatever you're listening to. I come from a planet Mars. That's actually my name too. And I've never written a script for a podcast before, so please bear with me. And I'm a little bit awkward right now because this mic is basically touching my lips. I did a little sound test, and that's what gets the best audio. And it's kind of weird. But I'm sure if you're here, it's probably because you're my mom or my aunt or a family friend, and you know that I am a super creative person and I love making all types of art like poems, painting, clay sculptures, and the likes. And if you're not my mom or her friends, welcome to my channel. I've been at this for quite a long time. I don't know if I'm going to upload this to my main channel or my second channel. So I started making YouTube when I was like 11, something like that, when I got my first camera for my birthday. And I used that channel for a really long time. And then sometime in my early adult years, late teens, I lost access to that, so I started uploading to another channel, and now I just kind of upload stuff wherever I want. So I don't know where this is gonna be. Just for a little bit of context, this is episode numero uno, the very first script. I didn't even revise this stuff. Some of this is coming off the top of my dome. Anyways, welcome to my channel. Um. Anyways, to get straight into the point, because I don't want to seem like I'm ripping people off, I will say that I have been very heavily inspired by my friend Cameron Myra, who actually just started their own podcast not too long ago. It's called Dust Bunnies, and I highly recommend going and listening to it. They talk about something a little bit different each week. Listening to Cameron's podcast really got me thinking, like, I really like to yap, but what could I possibly manage to talk about for more than 2 minutes straight? And hopefully this topic is good because we're already 5 minutes in, and I think I'm on page two of like five. So I think we got something going for us here. So anyways, I thought and thought and thought and then stopped thinking about it because I just started nursing school. Like this is week 3. This is the Monday of week 3 of nursing school. And my dad died and I've been working 2 full-time jobs since January. Like I do not have the time to add an extra project into my life. Like I should be studying right now. I have homework to do. I have a test tomorrow. But to be fair, there's a test every day. It's nursing school. It's an LPN accelerated program. There's a test every day. But obviously I thrive on chaos. I I feel like I personally am highly emotional and introspective, and then the moment that I gave myself time to breathe, to stop from everything in my life, I went, huh, I really want to talk about this one specific topic. And that topic is communication, mental health, and just general life stuff. Like, I know y'all aren't my therapist, but like I said, I just love to talk. And as of writing this, I said I'm sad and I want to talk about it. So, as I mentioned, I just started nursing school. And as of writing this script, I've only been through 2 weeks. Like I said, week 3. So, by no means am I any kind of expert or authoritative figure on any of the topics that I bring up today. This is my own personal feelings. And if you are somebody that's later on in your nursing program, or if you are a nurse, or you just graduated waiting to take your NCLEX or NCLEX, whatever you want to call it, I've always called it NCLEX. And then I heard somebody say it the other way, and I was like, You're studying for your what? This might be a little bit triggering for you. No, I kid, but some of this stuff like therapeutic communication, we just had a class about that, and like I said, I'm no expert, but it really got me thinking in my little noggin. So our main lecture point in class on Friday was communication techniques. Specifically what they're really trying to hammer home is the difference between therapeutic and non-therapeutic communications. But the thing about it, it's like, do you want your nurse to be aggressive, dismissive, apathetic, and just generally seeming like they're not prioritizing you? Or do you want your nurse to be empathetic, open, honest, and to foster a relationship that's really built on trust, that makes you feel confident about whatever you're having to interact with the healthcare professionals for? And like, I'm like 99% sure that most people would choose the nurse that makes them feel comfortable. Like, why would you want to interact with somebody that makes you feel awful on what could be one of the worst days of your life? And the patient population can be so vast. Everybody's different. Every single person that a nurse comes into contact with will require slightly different care, including in communication styles. Like, communication with a patient or a client is the basis of trust in the professional relationship. And to do this, they teach us that it's by being assertive instead of passive or aggressive, or being passive aggressive, because that's honestly just aggression with extra steps. So, you want your nurse to be confident, honest, have an appropriate affect, be professional, and to stand tall and open. And I would absolutely love to be all of these things, but I'll be so for real right now. I'm not. I'm not there yet. I'm a very emotional person, and I've struggled with my mental health for a long time. I'm currently 23 years old and I've been suffering with my mental health since I was a child. Um, OCD, ADHD, anxiety, depression, lots of baggage. I'm somebody that's done a lot of therapy and learned some things here and there, but like, I don't know if I'm being nice to myself or not saying that. I just feel like I haven't learned that much. Like, depression is hard, really, really hard. And historically, I've never been at a point in my life where I felt well enough to really say to myself, let's just do this thing, dude. Let's fix this. Let's work on life. Like, I know life is hard, but I am still alive and I have a shot and I'm gonna go get this thing being life. You know, I've tried therapy, I've tried meds, journaling, the whole shebang. I've been working incredibly hard to get myself out of the rut that I perceived myself to be in for a long time. A long time. My depression has been since I was like 13. I started therapy in 7th grade, I think, so 12 or 13 or so. And don't get me wrong, the the coping mechanism thing kind of helped a little bit, and some have been more helpful than others. Some things that I've done have been critically helpful. Like, there is hope out there. I'm absolutely not saying that if you're in a similar situation to me to stop trying, because for me, therapy wasn't my biggest oomph. It wasn't my biggest push towards starting to feel better. But highly recommend to use the healthy coping mechanisms that work for you. Keep going to therapy. Keep taking your medications if that's what you and your physician have decided that's what's right for you. But what I am saying is that nothing has really been that one thing that has made me say to myself that I'm ready to pull myself up by the bootstraps and face this whole life thing and being an adult head on. But I have. Recently, it's been like a paradigm shift for me. A total change in the way I've thought about myself. Like, obviously, I'm not magically cured from my mental health conditions. Like, I wish it worked that way, but it doesn't. I've recently found myself telling myself out loud that I am ready to do this. I am going to do this. And I'm going to succeed at making my life better. I am going to feel better. Like, life is really, really hard and it keeps throwing hard stuff at me. But you know what? Like, the only thing the only person in Mario Kart that gets the devastating blue shell thrown at them is the one in first place. You know what I mean? And you can recover from that. Like, things are going to try and tear me down, and trust me, they have. Like, I'm gonna go more into detail about it in a future episode. I haven't even finished recording. I'm not even halfway through recording episode 1 right now, and I've already started writing episode 2. So, but what I'm trying to say is you can recover. Like, I have survived all of my previous hardships and I will keep moving forwards. I'm 23 and I'm still alive. I didn't think I was going to graduate high school. I didn't think I was going to graduate middle school because middle schoolers are emotional. There's a lot of changes happening, and I did not really have the adequate support that I needed for especially my ADHD until now. I mean, I'm 23 and I just started taking ADHD medication this year and it has been a complete life changer. Like, I have gone to college and dropped out twice already. Um and I just really really want this whole nursing thing. And I said, listen, I was diagnosed with ADHD when I was like 13. It's time. Like, I need this medication. I can't keep raw dogging this. And it has changed my life. Like, I'm so serious. With a little bit of that, um That being said, I really don't know what has caused this big change. Like, I have been thinking about it, and I think it's just a bunch of little things all together. Like, maybe it's my brain developing because I'm 23, halfway to 24 already. Like, maybe I'm finally almost done cooking up there in my noggin. Maybe it's the tiny little coping mechanisms built on top of each other for years and years. Like, maybe it's the fact that I almost feel like I literally can't give up now. Like, I'm too far in. I have paid thousands of dollars to go to nursing school, and there's gonna be more. Like, I can't. The only way I'm getting kicked out is if they drag me. I'll be gripping onto that tile. Like, they're gonna have to get a weightlifter to pull me out of there. Maybe it's Maybelline. Sorry, I had to throw that in there. New York. But I encourage everybody at your highs or at your lows to just keep going. If you're at a high, don't get complacent. You still need to work on yourself. And if you're at your lows, give yourself grace. Like, it is worth it. You are worth it. Keep going. So, I just want to wrap up this part of the conversation by saying that you are not alone. Like, please, if you're struggling, do not do it alone. Don't do it in silence. I I recently lost my father, and he was a very brave, hardworking, and loving man. And I will never pretend that I understand what exactly is going on in somebody else's mind. But so far as I can tell, something was bothering him. He had something in his life that was deeply troubling to him, and I can't ask him now what it was. I wish that I could. I can make an educated guess, but I will never know. And in the end, he was trying to better himself. I'm not gonna go into too much detail just to respect him and my mother and my family's privacy, but he was trying, and I am incredibly proud of him for that. But he was not fully honest with anybody about how bad his situation was. And ultimately, he lost his life due to complications of his disease process that he was hiding from everybody. It's not helpful to ponder on what ifs, um, but I do believe that if there was more honesty in this situation, that the death might have been preventable. And that's one of the hardest things for me to cope with right now. Like, I don't blame him. I do not. It's hard. The whole thing is hard. I feel incredibly sad for him, and I thought I was gonna start crying when I was writing this. I wrote in here that I'm probably crying right now while I'm talking about this. So if I am sorry, but also not really, because I am allowed to have feelings. In the insult to injury is that this happened because he was trying to get better, but when you suddenly discontinue certain things, it's just incredibly dangerous. So please, for the love of God or whoever you believe in, tell somebody, reach out, and please do not stay silent. Because if you don't, I am gonna drive my little spaceship over to your house and abduct all your cows, and then you won't be able to have cheese to make your pizza or your nachos. So keep that in mind, okay? And so how does this all tie together? How does my sap story of my life tie into communication and nursing school? Is first of all, I went off on a little bit of a tangent, but I feel like that's kind of the point of a podcast anyways. Second of all, it has a lot to do with everything actually. So, to reiterate, To be able to effectively communicate with patients and colleagues, a nurse needs to be assertive, not aggressive, not a pushover, and that's not something that happens overnight. You need the knowledge and the words to explain what's expected from you. Like, you need to identify what you need, what might need maintenance in your life and in yourself to be able to implement these changes. And then you need to actually practice before becoming more assertive. At home, at work, with your friends, your neighbors, everybody. With me, with the aliens. The fundamental foundation of being assertive is honesty. To be assertive is to be honest. Like, that is one thing they're hammering into our skulls. And isn't it fundamentally dishonest with yourself and everybody else to practice being assertive only at work or at school, even if it's a big portion of your life right now? You know, like, you as an individual matter, your opinions matter, your feelings matter, and you matter. So if you're only practicing being assertive at work or at school, but you're not assertive in your everyday life, you're not being honest. And if you're not being honest, you're not being assertive. Practicing is one thing. When you're practicing, you're not fully there yet. But putting on a facade is not honest. And it doesn't help anybody. You need to practice and self-reflect, Before I even had the words to understand what I was trying to do, I have been trying to be more assertive and stand up for myself this past few, I don't even know what time frame I would give it, just recently. But unfortunately, I've gone nearly 24 years of my life being a pushover. Like, just a few months ago, I'd say, I told myself that enough is enough. Like, I'm not doing this anymore. I'm gonna start trying to stand up for myself. And what's the first thing I did? What do you think of the first thing I did? I let people step on me, step on me, step on me. And then I said, I'm not doing this anymore. I went completely overboard. I exploded. The years of constant self-repression exploded everywhere. And it's not the first time. It has happened before. But in the past, I lingered on it. I felt bad, my thoughts were repetitive, and this mindset was not conducive to helping myself heal and move forward. So, what did I do this most recent time? I walked away. After this altercation, I walked away. I cooled off for about 30 minutes, ate something, vented to my friends in privacy because I know these are people that I can confide in and they're not going to go gossip. If you're listening, hello, Aubrey and Kaylee. You know exactly what I'm talking about when I sent like 50 voice messages in the TikTok group chat. But once I was done doing that, I composed myself and I apologized to the other party. Do I feel as if my anger towards the situation was justified? Yes, I still think I was on the right side of history here. But it was not justified or kind or professional for me to lash out at a coworker. So I apologized and explained myself, like where I was coming from, and listened to what the other party had to say as well. And all I can hope is that she's also able to move past this with me with no hard feelings. Like, it's not like I screamed or called her names or stomped my feet, but I did not think twice before my words came out of my mouth. I was angry and highly emotional 1 week post my father's death and pent up. And I did not think twice. I quietly argued with her because we're at work and I'm not dumb. Angry or not, I'm not dumb. But I was not being assertive like I was wanting to be. I was being aggressive and I let the pendulum swing too far. And my husband just joined the room with me and say, "Hello, Chris." He waved his hands. um, so yeah, I let it swing too far. Like, you want to be in the middle, and I went from fully left and I swung all the way up into angry territory. Like, it happens, life happens. I can't say that my behavior was correct, but it happens to the best of us. And we need to examine situations like this so that we can move forwards and not just do it over and over and over and over and over again. Anyways, I'm gonna wrap this episode up with a few songs that I want you to listen to. Or not. I don't care. But these are some songs that have sort of been on the soundtrack to my life recently. Sometimes they laugh, sometimes they make me cry, but they have all been fairly comforting to me, and I feel like they kind of fit the theme of this episode as well. So these songs include Vienna by Billy Joel, My Shot by the Hamilton Crew. Yes, I'm a Hamilton lover. Love it or leave it. Rises the Moon by Leanna Flores, and Who Knew by Pink. Pink, like uppercase. You know who Pink is. So, anyways, just wanted to say thank you for listening to the end and listening to me rant if you made it this far. Stay safe. I don't know you, but I love you. You matter, and people care about you. No matter what you're going through, hang in there and have a good week. I might take one of your chickens so that I can have a little pet with me to go back to my planet while I write the next episode. Bye bye.